Blake. I'm Dr. Gibbon, and I'm going to be doing an abdominal exam on you today.
Okay.
Alrighty. First of all, we're going to start with a couple of questions. Have you been having any kind of pain in your abdomen?
No.
Okay. How about any indigestion or
Nope.
stomach pain? How about ever been diagnosed with any types of hepatitis?
No.
Any gallbladder disease?
No.
How about any other GI diseases like Crohn's or celiac disease?
No, ma'am.
All right. How's your bladder? Everything okay?
Yes.
Any recent UTIs?
No.
No problem with blood in the urine?
Nope.
Okay. How about your bowel habits? Have you any constipation or diarrhea?
No.
Any blood in the feces?
No.
Okay. And you've never had gallstones?
No.
And I'm not seeing any scars for any surgeries. Does any kind of cancer run in your family, colorectal or stomach cancer?
No.
And how about any changes in your weight, either gaining or losing weight recently?
No.
And do you drink alcohol?
No.
Okay. Alrighty, so with that, I think we've covered pretty much most of the things I could ever ask you about. So we're going to go ahead and do an inspection. On the inspection, we always start with just the general, looking for any lesions, any masses, the contour of his stomach, look for any indications of fluid, for ascites. I want to look at any scars, look for any gallbladder scars. If it was a female, any possible tubal scars, any appendectomy scars. And then we look at coloration. I will look at his nail beds. And the reason for this is we're looking for any signs of anemia, any malabsorption problems, any signs of liver. I look at his conjunctiva. I look at the nail beds itself for possible clubbing, for heart problems as well. Then we want to look at any discoloration on the stomach. Is there any bruising? Is there a Cullen sign around the umbilicus? Is there a gray Turner sign around the flanks? That could be indications of bleeding from any of the internal organs, even though he has no significant case history on trauma. I wouldn't expect to see those. The other thing is, if a female, you'd want to look for any distension that she might possibly be pregnant. We want to look for various other indications, like if he had liver problems, we might look for venous distension. It looks sort of like varicosities. We may look for a caput medusa, which comes out from the umbilicus. We could also look for abnormal pulsations that you may see through a AAA. Normal, some pulsations will be seen on the abdomen, but if they were exaggerated, you may see them in that situation. You want to look at the abdomen here for any signs of peristalsis, increase intestinal contractions, in case he had any kind of blockages. You could look for umbilical hernias and ascites. So that looks like we've covered a good bit of the inspection. So now we're getting ready to do the next step, which is going to be auscultation. Auscultation, we're going to listen to 3 different arenas for auscultation. We want to listen to the arteries for bruits. We want to listen to friction rubs at the liver and the spleen, and we want to listen for bowel sounds. So we'll start with the bowel sounds. With the bowel sounds, we're going to use the diaphragm of the stethoscope, and we will go ahead and listen in one quadrant for 30 seconds to determine the sounds, and then I will move to the other quadrants just to I can make sure that there are sounds in those quadrants as well. Okay. He had 24 clicks and gurgles, which is normal, at 12 times 2. Okay. Then listen in the other quadrants just to make sure I hear sounds. All right, all good on the bowel sounds. The sounds could be increased in early blockages, and then they will decrease in late blockages. Next, we're going to listen to the arteries, and for the arteries, we have to use the bell, making sure that the bell is turned on. And we usually start first with the aorta, which is 2 inches above the umbilicus. Then we do the renals that are 2 inches out. And then we go to the iliacs, which is 2 inches below and then 2 inches out. Okay. And you listen at those about 5 to 10 seconds just to make sure you don't hear any abnormal sounds, which are called bereaves, and they go trying to get blood through smaller areas of circulation. Okay. The next thing we're going to do is friction rubs, and friction rubs are going to be on the liver and the spleen in abnormal conditions. You shouldn't hear it normally, and in order to do that, I'm going to listen with my diaphragm and have him take 2 to 3 deep breaths in and out so I can listen to any possible rubbing of his organs against the parietal pleura. So I go to the bottom portion of his rib cage where the liver's lower edge would be, and I usually put it right about here because I'm going to have him take 3 deep breaths in and out. Go ahead. Okay, good. The spleen is going to be located in between the anterior axillary line and the posterior axillary line up in this area. So I come a little bit lower so that if the spleen is enlarged, it will come down and I will hear the friction rub. And so again, I will go ahead and have him take 3 deep breaths in and out. Okay. And everything is normal. There's no sounds heard on any of those. Okay, so we are done with the auscultation. The next thing we're going to do is go into percussion, and percussion again has several steps. We have about 4 things we're going to percuss, and so the first thing is just general percussion, and we should be hearing sounds that we refer to as tympany, which is air and air-filled organs, and then if we go over any solid organs, it will be dull or any fecal material. So we're usually going to do this in the stomach is divided into pretty much 4 quadrants is the basic way through the umbilicus. There are 9, but everybody does the 4 quadrants. So if we do 2 circles, we will get all the quadrants. And are you ticklish? Okay. Badly ticklish? Okay. Well, hopefully percussion won't be that way when we get to that. All right, so how's that? That's not too ticklish? And then we're going to the outer circle. And just, excuse me. Okay. Okay, and percussion is normal. Okay. The next thing we're going to do is percuss the size of the liver. And to percuss the size of the liver, we are going to start at the we're going to do 2 places, the midclavicular line and right next to the sternum. You doing okay? All right. So on the reason for the liver, you want to see if it's enlarged. And the liver should end here, but if it is enlarged, I want to start lower by his umbilicus and then work upward. And so you do the percussion in about finger breadth locations all the way up. And you'll hear it's the sound going from tympanic to dull. I'm in his liver. It'll continue to stay dull till I hit his lungs. And then I can look and measure that, and it should be 6 to 12 centimeters, about 4 to 5 inches. Then I'll do the same thing next to his sternum. There it is. Again, that should be 4 to 8 centimeters. So everything's good on the percussion of his liver. The next thing is we can do his stomach. And the stomach, it's going to be in this area, usually midclavicular line, a little bit below the apex of his heart. And I can hear the gastric air bubble. Okay. The next thing is for the spleen. Now, the spleen is usually going to be hidden way up under here, like we said before, but there's a space, you find his lower rib cage going like this, and so we want to make sure that the spleen does not enlarge. And if it enlarges, it will come down when he takes breaths in. All the organs, whether it's the kidney, the liver, or the spleen, when they take a deep breath in, it will force any of the organs down so we can see if it's enlarged. And when he exhales, they will recede back to their original place. So with the spleen, we're going to do a thing called trobe space, and make sure the spleen isn't down here first. I just want to make sure it sounds nice and tympanic. Okay, so the spleen is not down here. Now I'm going to have him take a deep breath in and hold it. And the spleen, you can breathe out again. The spleen has not dropped down into trobe space, so he does not have an enlarged spleen. And that should be the end of the percussion. There will be a kidney percussion test. That is called Murphy's punch. We usually do that at the end after palpation. Okay, so we will do that at the very, very end. The next comes palpation, and again, there's several areas that we're going to palpate. First, starting